A very good morning, and I am highly grateful to present myself here today to present a good innovative research program in the PSIM. So my topic of presentation is that what's the clinician's perspective on the use of artificial intelligence applications in diagnosing and managing patients. First of all, before coming to what basically clinicians perceive about it, we would come to know what basically artificial intelligence is. It's basically the theory and development of computer systems that are able to perform tasks normally requiring human intelligence, such as visual perception, speech recognition, decision making, and translation between languages, so that we can involve human intelligence to function in the computer algorithms. While talking about the introduction and the history of artificial intelligence in medicine, we come to know that it has basically involved almost all the departments, all the industries, and all the areas in the world. But in the medicine and healthcare department, the first algorithm was established in 1976 when a computer algorithm was used to identify the causes of acute abdominal pain. Moreover, afterwards, there has been diverse and multiple applications of artificial intelligence in medicine afterward, especially in radiology, in emergency medicine, and moreover, in general medicine as well. If we talk about the research objective, the objective of this study was to investigate the awareness of artificial intelligence among the Pakistani doctors to see how they are helping and they are using medical applications for diagnosing and managing their patients. The study design was a cross-sectional study, and I almost took 220 medical practitioners to fill a questionnaire that was a Google form to assess the perspective of the clinicians. The demographic profile included 220 people who were male and female in different age groups from 20 to more than 50 years, and they were working in multiple medical specialty departments with clinical experience of less than 1 year to more than 10 years. While looking at the areas, I just figured out that only about 20% of the people have a very good understanding of artificial intelligence and they were using it. Other than that, 80% of the people knew about it, but they didn't have a very good understanding of artificial intelligence and they were not using it for managing and diagnosing their patients. So when talking and filling the form, I get to know that the perceived advantages of the artificial intelligence were that they think around 36.8% of the clinicians believe that basically it clinically delivers the data in the real time. Artificial intelligence speeds up the process in the healthcare. It reduces the medical errors, and there is no emotional exhaustion or physical limitation, especially in the emergency medicine. And the most useful applications were not the making diagnosis or making treatment decisions or not, doing treatment including surgery, but it was more about biopharmaceutical research and development, and moreover, somehow medical assistance, but not the treatment plan and not diagnosing their patients. So the clinicians basically perceive that there are 81.3% of the doctors suggested that no doubt AI is useful, but still they think that human experience is better than the artificial intelligence. Some people or some doctors basically suggested that it can clinically erode their thinking process, and some believe that it can also replace their jobs. So anytime in their life, if they have to choose between a doctor's experience or the artificial intelligence opinion, they would take the opinion of human experience. So what were the concerns and the limitations that the clinicians suggested were that AI is not useful in the unpredictable situations. They said that every patient is different from one to another, so that's why artificial intelligence is not flexible enough. said that they will definitely take help of artificial intelligence in clinical decision making, while 55.9% said that it would be possible that artificial intelligence should be integrated, but not universally. But that they don't believe in AI and therefore it shouldn't be used in clinical practice. This study suggests that clinicians have favorable attitude toward the usefulness of artificial intelligence in medical field, and it has the potential to essentially diagnose and make the decision in next 5 to 10 years. However, AI can erode the clinical thinking process and it can replace their jobs in future. So while looking at this whole data and performing this research, I came to see that there are few limitations. First of all was that while I told in the beginning that a lot of the clinicians didn't even know that how they can use artificial intelligence in their decision making, in their diagnosing, in the treatment plan. So there was a lack of extensive experience with artificial intelligence among the clinicians. And second thing, that the research was only done in one institute. If I was talking about all the areas, like I was talking about Pakistan, then I should have taken multiple other hospitals, multiple other regions, so that this geographical and cultural context should also be involved in this. So for my recommendations, I would say that exposure should be given to the clinicians. They should be exposed to artificial intelligence application. They should know how to use it. Training sessions should be done so that they know how their work can be done easily. And then standardization of artificial tools should be done so that it increases the reliability, accuracy, should develop the confidence of using artificial intelligence in medicine as a supplement rather than the replacement. So they will develop a confidence on the artificial intelligence and they won't think that it would erode their thinking process and they would not lead to replacement of their jobs. It will actually help them with their clinical diagnosis and treatment plans. Thank you so very much.